Good morning, good morning. Hello, everybody. So typically I'm in surgery on Thursdays, but I had a big surgery that had to be rescheduled. So I had this big gap in my schedule. So I got to be home with my kids this morning. I go into the office this afternoon. So you might hear my kids, they're outside on the playing bubbles with Myla Rose, but they might interrupt. But this is a good time for me to talk. I was supposed to go live last night and didn't get around to it. So we here now. And I want to talk about who are good candidates for liposuction. Because that's the most common thing that I do. And I'm also conservative in my approach to trying to get people to their happy place. And sometimes if I can get people to a place where they are confident in their clothes and feeling good without doing big cuts, then I try to do that whenever possible. So I do liposuction more than the average plastic surgeon. I do liposuction sometimes when other docs would say tummy tuck. And so I want to talk through my process with my patients for determining who we just do lipo with, who I'll go straight to a tummy tuck with, and that sort of thing. So first things first, we'll talk about what it's not for. Liposuction is not for weight loss. So if you're like, need to lose 50 pounds, you're like, I'm just gonna get a whole bunch of lipo, that's not who it's for. It is for people who are down to the size that they want to be, as long as that size is somewhere healthy. And then there's trouble areas that you want to attend to so that you don't have to lose the weight in all these other places to get this particular area under control. So you can do liposuction on pretty much any part of the body. There are some areas that I personally try to avoid. But for the most part, the average patient I have is getting liposuction on their abdomen, their sides, their back, bra rolls, chin, arms is big, thighs. The thighs, the most common place I do it with the thighs is the upper inner thighs, but sometimes I'll do the whole inner thigh, and sometimes I'll do what I call like a lipo 270, where it's not the entire circumference of their thigh, but it's like the majority of it, to just slim their whole thigh down in general if their skin is in good shape. So, I mean, really you can liposuction pretty much anywhere. Sometimes people have like this hump right there, we can lipo that down. All kind of places we can get lipo. There's a few things that I'm looking at to determine if, like say for your arms, if you're a good candidate for liposuction of the arms. If your arm skin, they are screaming and hollering. They're fighting. Sorry. If your arm skin is really loose, if there's stretch marks in it and it's really, really loose, then you might be better served with what's called a brachioplasty, which is basically an arm lift. You'll end up with an incision, but if I go and deflate it and your skin is not going to shrink back, that actually would look worse than your arms with the fat in it. So skin quality is a big one that is used to determine whether or not somebody's a good candidate for liposuction. There's certain areas where the arms is one area where I'm literally like, you need to get a brachioplasty if the skin is too damaged. But the belly, even if the skin is damaged, I still may do liposuction only in that setting. With the understanding, the patient has the understanding that you may have skin still hanging, but if the person's like, I really am not trying to get a tummy tuck. I'm not trying to go through the recovery attached to a tummy tuck. I don't have time to be down like that. I really just want to look better in my clothes. I'm not trying to be on no beach in no swimsuit. I'm not doing that. I really just want to look better in my clothes. Then I would be willing to liposuction that person, knowing that with the understanding, we both having the understanding that the skin may not shrink all the way, but they've gotten the bulk of the volume down in the girth down in their abdomen. Sometimes there's a little bit sometimes there's people where I can't really tell if the skin is going to shrink or not because stretch marks aren't a deal breaker. Some people, it depends on the type of stretch marks. There's some stretch marks that are really superficial and I can tell their skin is probably still going to shrink. Then there's stretch marks that are much deeper and there's like a lot more damage to the skin overall and I can tell that it's not going to shrink at all. And so sometimes I'll do liposuction on an abdomen that has some stretch marks on it with the understanding that they have a real chance at the skin pretty much shrinking all the way up. They'll just still have their stretch marks. So it's really not cut and dry. It really depends on the goal of the patient and the quality of their skin, also their muscles. In the case of the abdomen, if they have a really big separation in their muscles, then that will oftentimes be contributing to the projection in their abdomen. And so that's all those things we're kind of weighing out. I practice in Georgia. I'm in Georgia. What else am I thinking about with liposuction? That's the big thing. So I want to show you guys a pic. I'm going to show you a before and after of a lady who could have gotten a tummy tuck, and that wouldn't have been wrong. She didn't want a tummy tuck. She didn't want to go through the recovery attached to a tummy tuck. And with this patient, we have this is the type of patient that I have the discussion with ahead of time. Listen, if the skin doesn't shrink enough, we can tuck you afterwards. We can come back and do a tummy tuck later. I'm not like, do it all at once all the time. Like I'm not going to liposuction your abdomen and do a tummy tuck on your abdomen at the same time anyway. Like I won't do that. Some surgeons do it. It's not wrong. There's a complication that is high. You have a higher risk of called necrosis when you combine those two procedures. And I just don't like that complication enough. I don't think it's worth it. So I just always separate the two out. Abdominal liposuction and tummy tuck. I'll lipo your sides at the same time as your tummy tuck. I'll lipo your back at the same time as your tummy tuck. I just won't liposuction your abdomen at the same time as your tummy tuck. Do you usually do a tummy tuck or lipo after C-section? A C-section doesn't have anything to do with my decision making of whether a person gets a tummy tuck or lipo. You can have a tummy tuck or you can have lipo after a C-section. A C-section doesn't interfere with any of that. Okay, let me show you this picture. So this is a lady, you see her, so it's rotating. But this lady, most places she would have gone to, they would have told her tummy tuck. And we talked about, yeah, you can get a tummy tuck. I could definitely do a tummy tuck. Because you see she's got a little bit of skin left behind when she comes back to the front. You can see she's got a little bit of skin left behind, but she looks really good compared to where she started. Her shape looks totally different. And she didn't go through the recovery of a tummy tuck. She was back at her life in 3 days. Look how it made her butt look bigger. You see how her butt looks different? I didn't touch her butt. Wait till she comes to the side. I didn't touch her butt. Look, I didn't touch her butt. You see that? That's liposuction. All. And so she's got a little bit of extra skin. We could go back and do a tummy tuck. And I have some people who are like her when they just have that little bit of skin and they're like still like, I think I want a tummy tuck. And they get their tummy tuck. It doesn't hurt anything. It separating the two reduces her risk of necrosis. What's up, Mama?
It's a dog.
It's a dog?
Yeah, it's a dog. That was barking at us.
Oh, it wasn't louder than my little
But we finished the bubbles.
But I'm not finished with my video.
Let's go, Mama. Let's go. Mama, let's
You want to go play?
No, but the bubbles doesn't work.
We got more bubbles downstairs. It's in the garage.
Yes.
Bennett,
We can do it.
there's bubbles in the garage. Remember the big thing of bubbles?
Okay.
Please help me.
Yeah, I know. Let's go, Myla. Okay. Big bubbles are in the garage, Mommy. In the garage. They're in the garage. They're in the garage. The big bubbles are in the garage.
Do I have back fat pictures? I can have some back fat pictures for you on my next one because this one, I had this loaded in my phone already for today. So the next time I do one, I'll have back fat pictures. You can see a little bit what happened to her back. Like that's just for me working on the side on her. But scooping out the fat in the lower back makes your butt bigger. Look bigger, even though you don't touch it. I didn't touch her butt. Nothing happened to her butt. So, okay, and then here, so this lady, you see she's got a little bit of extra skin left there. because we opted to just do liposuction, and she's happy. She's not trying to go and get a tummy tuck. She good. She like, I'm good. All right. All right. So let me see. Let me show you. Stop sharing. Hold on. Let me show you one other one. Okay. This lady, she was abdomen flank liposuction. This is somebody that a lot of people would have said, you need a tummy tuck because it looks like she probably has a diastasis, meaning a space between the muscles, the six-pack muscles. And so that's part of why her belly is sticking out. So sometimes those muscles, like after you have a baby, like these are, say my hands are the two muscles that make up your six-pack muscles. They're supposed to be like kissing. After we have babies, we expand to hold the baby, and when it comes back down, they come back down separated. Well, when they're separated, it makes everything kind of loose and bow out, and that's what makes people's belly stick out from the diastasis, right? So when you tighten that space up, it makes everything go back taut and be flat. Well, sometimes with liposuction, please don't misconstrue what I say. Liposuction is not how you repair a diastasis, okay? However, sometimes depending on how strong people's scar tissue is, when you get put in the compression garment after the liposuction, the compression garment pushes the muscles back together, and then your body proceeds to lay collagen down on top of it. So it's almost like a gorilla glue situation. And so sometimes people after liposuction, when they're like small like this, sometimes people, their diastasis will not really be pronounced anymore. And I believe it's because the garment pushed their muscles back together and their scar tissue was like gorilla glue and kind of held them there. So sometimes lipo people, when they need lipo, I'm like, listen, I just really don't want a tummy tuck. If I could just get this down some, I'm like, okay, bet, understand. If you got a diastasis here with the other ladies, like you got some skin that's a little loose, it's already hanging a little bit. So understand that if it don't get you all the way there, the way we finish is to do a tummy tuck later. And they're like, all right, bet. And so then now this lady, it worked out. It worked. We don't need to do a tummy tuck on her. She was able to get by with liposuction, back to her life in 3 days. So let me go back and look at some of the questions you guys were asking. And do you do more than one lipo area? Yes, I'll do several lipo areas at once. There is a limit. It depends on how big you are to start. So that's a question I can't answer for individuals without seeing what we're working with. But definitely people get multiple areas of lipo at one time. I don't give prices over Instagram. All right, I think I kept up with the questions. Okay, so here's the deal. I got a couple spots that I need to fill. They're short spots. They're like an hour and a half little spots in my schedule in June. A couple dates in June and a few in July where I can fit short surgeries. So if I got a special again for abdomen and flanks because I need to fill those gaps in my schedule. So you can get a discount if you're able to get into them gaps in my schedule. So if you're interested in liposuction, give us a call today because once we fill up those couple spots, that'll be the end of it. Once I fill up those gaps, I got small gaps for small spurts of OR time here and there on my schedule. And so if you're interested in liposuction of your abdomen and flanks, call my office 678-325-0006. Ask for Tiara, 678-325-0006. Or you can hit up my consult site. Here, I'm going to put that here. You cannot really actually be trying to tell me something while I'm trying to.
Oh, this is.
Okay. Here's mine.
Let's play with some more. Let's go.
Pin this. Oh, that's how I do it.
Let's go
Okay.
with bubbles.
Is the tummy tuck recovery the same as a C-section? Oh, is the tummy tuck recovery is different than a C-section. It's easier than a C-section, from what I understand. Now, I've had a C-section before. I have not had a tummy tuck, but my patients who have had both, the tummy tuck is easier. The reason being is, like, with a C-section, you have literally had your organs manipulated. You know, a baby was cut out. They cut into your uterus. Like, your organs are healing. Tummy tuck is just a skin operation with a muscle tightening. So you have an incision that you're nursing, but the deep pain that comes with a C-section is not a part of a tummy tuck surgery. If you come from out of state for a tummy tuck, you got to stay 2 weeks, unless you're like at one of the bordering states where like it's like a 3-hour drive home. Then I'll let you leave after a week. But if you're flying to me, you need to be here for 2 weeks. Ask for Tiara. Call and ask them details. I don't know the details of my schedule. Tiara know that stuff. Somebody said if you fill up before we can get to those dates, are you booked for the rest of the year? I don't know. Tiara knows. She the person. Call and talk to Tiara. The stay for lipo, if you're driving from a bordering state, you can leave the next day. If you're flying, you need to stay for 5 days. The flight is the thing that I don't want people hopping. I don't want people hopping on the airplane the day after any surgery. The general anesthesia increases your risk for blood clots. The flight increases your risk for blood clots. The compression garment increases, like all the things. So, after lipo, even though you'll feel fine, I need you to hang around for 5 days if you're flying. Yes, I do brachioplasty. Yes, you can have lipo when you've had a mesh hernia repair. Oh, my nails. Thanks, honey. I don't do the long, pointy, scary nails. I'm like plain. I'm a plain Jane. It's a little bit of sparkle in there. I try to pick colors with a little glitter. I mean, that's as fancy as I'm gonna go. And I can't wear them long either, because it'll bust breast implants when I'm trying to do breast dogs. Why 2 weeks? Because tummy tucks, I need you to not be having any complications that need another doctor before you leave here. Or so 2 weeks is kind of the window where we get out of major issues happening. Also, 2 weeks out allows you to get your body to get to a place where it's equilibrated, where your blood clot risk is down. So like I've had 2 patients in the course of my career get blood clots that went up to their lungs. They didn't die. But both of them traveled from out of town, and both of them got tummy tucks. Once I started, so now I put people on blood thinners. All of my tummy tucks get put on blood thinner shots for 2 weeks. And then my out of town people who are flying home, I'll have them take the blood thinners up until they get home. And when people go home, their drains are out, like the incision is on its way. Like, I don't need you to get home and be like, I got this stuff leaking out of my incision, and then now we're trying to find a doctor there to help. Like, that's just drama. So you got to stay for 2 weeks so I can take care of whatever. My stomach hangs, so will lipo help? I got to see it, and don't send me pictures in my DMs. That's what a consult is for. Very well made. That one picture that I showed, the first one, I don't know if you were on here at the beginning, the one who just asked that question, but her belly was hanging, and she just had lipo, and she looks nice. So it's not a deal breaker. Stretch marks isn't a deal breaker. Hey, Carl. High blood pressure under control is not an issue at all. So my console fee is reduced when I have specials. It's real low. Now, my console fee is normally $500. It's $100 with the special. So if you want lipo, today is the day to call. It's $100. That's it. It's not $500. It'll be $500 Monday. So, all right, y'all. I think that's it. I'm probably gonna come back on here. I don't have to go to work till this afternoon. Y'all, my garden is doing so good. Some of y'all don't know about my garden because y'all are new. I got a lot of new people. But I planted a garden. It's been probably a couple months now. And I got cucumbers growing. My cucumbers finally are growing. I got real cucumbers out there. I got tomatoes. They turn red and everything. Like, I got a squash growing. It looked like a real squash. So I'm probably gonna come back on here and show y'all my garden. My phone number is 678-325-0006. And ask for Tierra. I'm in Johns Creek, Georgia. Yes. Yes, come on, growth. Yes. Like I do all kind of fancy things like with my job, right? But I cannot tell you, the only thing that was more satisfying than seeing them vegetables pop out was seeing humans come out after I carried children. I was like, that's a real person. That's how I felt when them vegetables sprouted out. Like that, I cannot believe I grew something that we can actually eat. Who knew? And it's a lot of work. And some days, like some weeks are really busy. And I know this don't have nothing to do with liposuction, but maybe I'll just show y'all my vegetables. Some weeks are really busy and I'll forget to water them, and then I'll pull up to my house and it's on like my patio is elevated, right? And so I'll pull up and I can see the tomato plant from the street of my neighborhood on the patio, and I'll be like, oh Lord, it's dead. I killed it. I'm like, it's dead. And I'll rush in the house and put all this water on it. And by the next morning, it'll be, actually by a few hours, the leaves will be standing back up again and full. And then the next day, like a new tomato will have popped out. And when it rains, like if it rains outside and it get a lot of water, the next day a bunch of fruit pops out. Like a bunch of vegetables like will sprout. It's amazing. It's fascinating. Y'all want to see my cucumbers and my tomatoes? I'll get off after I show y'all that. Be like, we want to hear about life, but we do not want to see your cucumbers. Well, I'm showing you my cucumbers anyway since I got you here. Oh, the barber here? Well, we know how she roll. I'm showing Instagram my cucumbers and my tomatoes. Look, y'all. All right. Okay, look, this is a green one, tomato. But look, this one turned red. This one just turned red. Look. Now check out. Look at these cucumbers. Look. That's a cucumber. It's a real cucumber. See, it's got a flower on the end. Look at this big one. Look at that. Cucumbers. I got real vegetables up in here, y'all. And then, let me see. These are peppers. These are peppers starting to grow, like bell pepper. Here's a squash. Look at that little squash. Ain't that crazy? Like these things is going crazy. Like it's taking over. These cucumbers, look at these leaves. These look suspect, but they growing. I don't know what's up with the leaves, but it's growing. See? There's little tomatoes everywhere. Look, there goes some more tomatoes. See? Started from nothing, and now I have real vegetables. Yeah, it's fascinating to me. Like I never gardened before. Like I didn't never. The good thing about doing it this way, since I didn't plant it in the ground, is I don't got to deal with all of the rodents and stuff. Cause I'm up in the air, like I don't have a bunch of insects. I don't got to deal with worms. I'm a farmer, yes, Coach Tabitha. You see the tomato, Myla Rose? You want to show Instagram the tomatoes, Myla? Myla Rose helps me with these. Look, you see that? Show Instagram.
This one's
Yeah.
She grabbed one off the other day. Oh, what's this?
Yeah.
What's this one?
I don't. So I was talking about these things. Like, look, these things grow. This is coming. Now this is a tomato, but look, this one grew from the tomato over to the cucumbers. They like. It's like they reach out to each other and all get interconnected.
Mom, look at this.
Yep. Look at that squiggly thing. You see? I don't know what these are. Does anybody know what that is?
Can you hold the phone?
Hold on. You want to see the phone? You
Yeah.
Want to say hi?
Hi.
Found the bubble gum, bro.
Yeah.
Hold on. We gotta turn it around. You trying to show them, Mama?
Yeah.
Oh, somebody told us about the squash bug. I don't know about that.
Mommy!
What?
I need to hold the phone.
No, you don't need to hold the phone.
I got to hold it.
Tell me about the squash bugs.
I can't see.
They are vines. If you post it up, then they grow up. I know. I need to.
I can
Okay,
see.
that's what I need to do.
I can see,
I need to go
Mommy.
get Myla Rose.
I can see.
Okay, hold on. I need to get the little sticks things to get it to grow up because I didn't know that the cucumbers were gonna do that. I ain't know. So that's how vines start. So tomatoes make vines too. Child, I don't even know what I'm doing, and I was able to grow something. You just said that this morning. Yep.
Yeah, look at that one, baby.
Don't pull it.
Oh, that's you, Cassandra.
Mommy, look at that one.
Yeah, I see it, Myla Rose. She's gonna know how to grow because she actually does help me. She comes out and waters them.
Wow, Mommy, look at the baby pepper.
You see that baby pepper, Myla Rose?
Aw.
Wait, look right there, Mom. I think I see a big pepper.
Let me see.
Oh, look at that big pepper. Oh my gosh, look, y'all, look. It's turning colors. Look.
Wow, red, green.
Wait a minute, it looked like something got to it. Oh, Lord, look at that. That one got something. We can't eat that one. Look at that. Something got to
Look
it.
at that one.
Yeah, look at that one. Oh, that's a big one.
Wow, a big.
Dang it, something got to my pepper.
Mom, you want to check it out?
Anyway,
I'll
take one out. You want to take that pepper out?
Yeah, because I guess.
Wow,
Yeah, you
look
can
at
take. Go
that
get some scissors
fruit.
and put the garden gloves on so you don't prick
I
yourself.
think that's what I should do.
What?
Like, we should put the bad ones, like,
Mommy,
usually,
look at
like
that
a little dirt
fruit.
section and put them right there so the
Mommy,
animals
Mommy.
them eating
Mommy,
these
look at
plants,
that
they eat
fruit.
those.
Oh, that's a good idea.
Mommy, look.
Even if I don't know anything about
Yeah, it's
flowers.
growing. It's growing. Yeah.
Mommy,
Yeah.
look
Let's
at
see.
that fruit.
What you see right there, Myla Rose?
Look,
Yeah, that's a cucumber.
a cucumber.
Yeah, that's a cucumber, Myla Rose. She's so excited. She's trying to tell everybody it's a cucumber. All right. Anyway. Yes, isn't that exciting? That's how her mama is too. I'm like, take that red tomato off. Okay. Oh, cut the bad part off and use it. Okay. All right. We'll bet. My son asked me, could we do the red tomato yesterday, but it was like a little bit of green spots. But this morning when we came out, it was all red. So we're going to eat that red one today. I might take a couple of them green ones off and fry them suckers up. Huh?
Mommy, look at the tomatoes.
Which one? Well, let me see, Myla Rose. Look at that tomato.
Tomatoes. Tomatoes.
Tomatoes.
Tomatoes.
They have me to cut it down.
You want to cut it down?
Yeah.
No, they're babies.
No, they're not babies.
They're your age. Mothers.
All right, y'all. Thanks. Thanks for seeing my garden. That really made me more happy than anything else I've seen. This garden is fun, and I don't know what I'm doing, so I'm learning something new. And the Lord is actually ministering to me through this stuff, through this gardening process. Like, our lives is a lot like that. I'll get into that another day. I ain't about to do church right now, but call the office, 678-325-0006. Yeah, baby, I see all of those tomatoes, Myla Rose. You did that. You come out here and you water those tomatoes all the time. You did a good job, my mom. Yeah, they're very big. Myla Rose knows how to grow tomatoes.
How many tomatoes are you going to grow when you get older?
How many tomatoes? Are you going to grow tomatoes for your family, Myla Rose?
I cooked them.
Yeah, you going to cook them?
Yes.
All right.
I cooked them for everybody.
You going to cook for everybody?
I can cook it for Mr. Tree.
You going to cook for the barber too, Myla Rose? She cooking for
Yes.
everybody. All right, I'll see y'all later. Have a good day.